Hello guys, my name is Sheikh Yusuf. I am a second year MBBS student of Dr. Ullas Patil Medical College, Jalgaon. Today's topic of discussion is the anti-cancer drug. The learning objectives are microtubule damaging agent, topoisomerase 2 inhibitor, and the topoisomerase 1 inhibitor. Okay, basically, in a cancer, what happen? There is an uncontrolled mitosis occur, and we know that the cell cycle is consist of the cells is divided by the cell cycles, and cell cycle is consist of G1 phase, S phase, and G2 phase, and M phase. Basically, these drugs is act in the M phase in metaphase and S phase. Okay, so first move toward the microtubule. Basic what is the microtubule? Cytoskeleton is made up of three components, that is microtubule, microfilament, and intermediate filament. This cytoskeleton help in the cell maintaining the cell shape, and the microtubule, which is made up of a protein that is called as a tubulin protein, and this microtubule is a help in the formation of a spindle apparatus during the metaphase. Okay, so what basically this microtubule is do? This microtubule is form the spindle apparatus. See in this picture, this microtubule is form the spindle apparatus, and this spindle apparatus is goes and bind to the kinetochores of the chromosomes, and then this microtubules is pull this chromosomes, so that there is a separation is occur, and the chromosome is divided into chromatid, and it is further moved to the poles, and there is a two cell is formed. Okay, so this is a microtubule basically. The classifications of drugs are: microtubule damaging agent is further divided into the three categories, which is consist of the vincolcoids, taxanes, and the estramustine. The vincolcoids is consist of the vincristine, vinblastine, and the vinorelbine, while the taxane is consist of the paclitaxels and the doxytaxels. Okay, so move further one by one. This is a Vinca-alcoids. What basically mechanism of action? I already told you. In the metaphase, there is a formation of spindle apparatus is take place with the help of the microtubule, and this microtubule is bind to the kinetochores of the chromosomes. And when this microtubules is pulled, the chromosomes is moved to the opposite poles, and there is a formation of two daughter cells are occur. This drugs is this drugs is do these drugs is prevent the polymerization. Vinca-alcoids, see the mechanism of action of the Vinca-alcoids. These are the mitotic inhibitor. It is bind to the microtubule that is made up of the tubulin protein and prevent their polymerization and assembly. Okay, prevent the okay, the polymerization and prevent the polymerization assembly of the microtubule and disruption of the mitotic spindle and interfere the cytoskeletal function. The chromosome is failed to move apart during the mitosis, and the metaphase is arrested. Since the metaphase is arrested, the cell cycle cannot be further cannot be further divided, and the cancer is prevented. The cells is not divided, so the proliferation cells is not occur, and the cancer cell is suppressed the growth. The drugs in this category is consist of, that is a vincristine. Vincristine, it is nothing but it is the drug acting, that is a mitotic inhibitor, and it is used in the case of acute myeloid leukemia, Hodgkin disease, Ven's tumor, Ewing sarcoma, neuroblastoma, and carcinoma of the lungs. What are the adverse effects of this vincristine drug? It is causes the peripheral neuropathy, alopecia, ataxia, nerve palsy, autonomic dysfunctions like postural hypotension, paralytic ileus, urinary retention, and the seizures. Bone marrow suppression is the minimum, but the syndrome of inappropriate can occur. Okay, what basically occurs? This drug is act on all the dividing cells of the body. We know that there is a in the bone marrow there is a proliferations of the that is a bone marrow proliferation is occur, and the formation of different kinds of cells is occur, like the neutrophils and the RBCs and the WBCs are the occur. And also in the cells are regularly dividing pattern. In the hair growth is occur, so the cells of the hair is also regularly divide. So these drugs is also act on these cells, and due to that there is a side effect is occur, like there is an alopecia is occur and the bone marrow suppression. Okay, the dose of the vincristine is nothing. Dose of the vincristine is 1.2 to 2 mg per meter square area body surface area, and IV it is given in the IV and weekly. Next drug is the vinblastine. Taxon, see in this image, basically what happened when the microtubules is goes and attached to the kinetochores of the chromosomes. They require attached to the kinetochore of the chromosome. For the separation, there is required the pulling of the chromosome toward the opposite poles. so that the kind chromosomes is break and the chromatid is moved to the opposite pole. But this category of the drug, what do they bind to the they bind to the microtubules and prevent their pulling. It means that they stabilize the microtubules and prevent their pulling to the opposite pole. So the cell cannot be so the chromosome is not divided and the cells is arrested in the metaphase. And the cells, when the cells is arrested in the metaphase, their cells is undergo the cell death. Okay, this is basically this drugs is do. So what this drugs is do, this drugs stabilize the microtubule and prevent their depolymerization. See the mechanism of action. This category is consists of paclitaxels and this is a docetaxels. Paclitaxel, it is a okay. This is obtained from the tree, that is bark of the tree, that is western yellow tree. Mechanism of action: it exerts the cytotoxic action by a novel mechanism. Novel mechanism means it bind to the tubulin protein of the microtubule and enhances the polymerization and to form the excess of microtubule. It form the excess of microtubule or it enhance the polymerization, while the that is the vinca alcohol is causes the they prevent the polymerization. But this drug like taxons is enhances the polymerization and to form the excess of microtubules. Mechanism is opposite to vinca alcohols. Microtubules stabilize and their depolymerization is prevented, and this stability is a disrupt the normal dynamic or reorganization of the microtubule network that is essential for the interface and the mitotic function. Abnormal arrays or the bundles of the microtubule is produced throughout the cell cycles, and the cytotoxic action of the paclitaxel emphasizes the important tubulin microtubule dynamic equilibrium. Basically, I have already said that these drugs is bind to the microtubule and prevent their movement to the opposite pole, so the chromosome cannot be divided and the cells is arrested in the metaphase and the cells undergo the death, that is cell death occur. What are the indication of paclitaxel? It is used in the case of the ovarian and the breast carcinomas, and it is used in the first line chemotherapy, and it is also used in the case of the neck cancers, small lung cell carcinoma, esophageal adenocarcinoma, urinary and the hormone refractive and the prostate urinary hormone refractory and the prostate carcinoma. Then AIDS-related Kaposi sarcoma is also respond for these drugs, and dose of these drugs is a 135 to 175 mg per meter square body surface area by IV infusion over 3 hours and repeated every 3 weeks. Next drug is the next another categories of the drug, that is a istamostine. The name itself suggests that it is consists some of the component, that is estra means that is estrogen, and mustine is a nitrogen mustard normomustine. Okay, so mechanism of action, it is a this drug what this drug is do, it bind to the beta tubulin and interfere the organization into the microtubule and exerting the antimitotic action. Basically this drug is what do this bind to the beta tubulin of the microtubule and prevent their organization to opposite poles, so the microtubules is cannot be organized and the metaphase the cells arrested in the metaphase. Okay, cell cycle arrested in the metaphase. This drug is concentrated in the prostate and only indication it is indicated in the metastatic prostate cancer and non-responsive hormone therapy. Pharmacokinetics of this drug is orally active. First pass metabolism occur in the livers, and elimination occur through the feces, and small amount of hydrolyzed in the estradiol and normastine, producing the myelosuppression and estrogenic action. Since this drug is consist of the estrogen, and the estrogen in the lead to the, that is a gynecomastia, then is can the increased risk of the thromboembolism, then impotency, fluid retention, increase fluid retention and increased risk of the thromboembolism, impaired glucose tolerance, angioedema. Okay, and hypersensitivity reaction is also a adverse effect of this drug. Next, dose of this drug is a 4 to 5 mg per kg orally for 3 times a daily. Another category of a drug like topoisomerase 2 inhibitor. So in the S phase of cell cycle, there is a replication of DNA is occur. In the replication of DNA, the three main enzymes are DNA polymerase, helicase, and the topoisomerase 2. What helicase is do? Helicase is a break the hydrogen bond, and the DNA polymerase is form the new DNA strand, and the topoisomerase, when we uncoil the double helical structure, two helical strand of the DNA with the help of the helicase, there is a knot formation is occur in the forward direction. So this enzymes like topoisomerase what do this in this the mechanism of action of this enzyme is that is the uh, that is the prevent the that is it is break the knot of the for it break the knot and recycling mechanism, that is a knot breaking and reselling mechanism. So this drug is what do they break the knot, means they break the knot, and after breaking the knot they resell it so that the further DNA synthesis occur. But this kind of drug like topoisomerase 2 inhibitor, this drug is see in this image there is a red color, this enzyme is a topoisomerase, and there is a drug introduced. When the drug is introduced, that is blue color drug, is prevent the reselling mechanism, not a breaking mechanism. It prevents the reselling mechanism of the two strand, so the DNA polymerization is not further occur and the cells arrested and the cells undergo the cell death. Okay, this drug is in this category topoisomerase 2 inhibitor. The drug is a etoposide, and etoposide is a semisynthetic derivative of podophyllitoxin, a plant glycoside. Mechanism of action: it is not a mitotic inhibitor, but it arrests the cells in the G2 phase. Means after the S phase, there is a G2 phase. So the cells is DNA replication is not occur. So cells is arrested in the G2 phase. In the S phase, DNA replication now after the S phase, there is a G2 phase. The cells is occur arrested in the G2 phase and causes the DNA break by affecting the DNA. This is a DNA topoisomerase 2 function. While cleaving the double standard DNA is not interfere. Here mention that cleaving of double standard DNA is not interfere. The subsequent reselling is strand is prevented. These drugs is prevent the reselling of the strand of the DNA. Indication: what is used in the case of the testicular tumor, lung carcinoma, Hodgkin, and the other lymphomas, carcinoma of the bladder and the stomach. What are the side effects of these drugs? That is alopecia, leukopenia, and GI disturbances. Pharmacokinetics, that is a bioavailability 50% and orally is given. Then dose is 50 to 100 mg per meter square body surface area per day, IV for 5 days, and 100 to 200 mg per day orally is given. Another category of drug like topoisomerase 1 inhibitor. Topoisomerase 1 inhibitor, it acts in a similar manner that is a etoposide, that is a topoisomerase 2, but is interact with a different enzyme. It interact with the enzyme that is a DNA topoisomerase first. The binding to this nuclear enzymes is all of the single strand break in the DNA, but not a reselling after the strand is has untwisted. They damage the DNA during the replication and act in the S phase and arrest the cell cycle at the G2 phase. Okay. Next, these are the this category is consist of the topotecan and the irinotecan. So guys, this is a quiz time. So first question is that which of the following is not a microtubule damaging agent? In the classification, we see that the vincristine, vinorelbine, and the vinblastine. These all three are the microtubule damaging agent. But the paclitaxel, it is not a microtubule damaging agent. It is a taxans. Okay. Which of the following drug is a prevent the? So answer is D. Which of the following drug prevent the polymerization assembly of the microtubule? Polymerization and assembly of microtubule is prevented by vincristine, which is a Penca alkaloids. Okay. Which of the following drug stabilize and prevent the depolymerization of microtubule? Stabilization and prevent the depolymerization. These drugs is paclitaxel. Paclitaxel is a taxan which is stabilize the microtubule. Stabilization of microtubule is done by taxan, that is the paclitaxel. Okay, the option is C. For question number 3, the answer is 3 C. Etoposide. Etoposide is active by inhibiting which of the following enzyme? Etoposide is comes under the category of topoisomerase 2 inhibitor. Option is A. And then which of the following is not a topoisomerase 1 inhibitor? Topoisomerase 1 inhibitor. So in the classification we see that topotecan, then irinotecan. These are the topoisomerase 1 inhibitor. So option number C, etoposide is a topoisomerase 2 inhibitor. Okay guys, thank you.